My name is Dr. Shelley Keating. I'm an Accredited Exercise Physiologist, a researcher and senior lecturer at the School of Human Movement and Nutrition Sciences at the University of Queensland in Brisbane, Australia. My research is really focused on the role of exercise in the management of a condition known as metabolic dysfunction-associated steatotic liver disease. It used to be called non-alcoholic fatty liver disease. MASLD affects 1 in every 3 adults worldwide, so it's a very high prevalence, although a lot of people living with the condition aren't aware that they are living with the condition. The condition is strongly linked with the development of other conditions such as type 2 diabetes and heart disease, but it also has liver consequences, so in some people it can progress to more severe liver disease, including liver cirrhosis and hepatocellular carcinoma. The primary therapy for the management of MASLD is weight loss via lifestyle intervention, so that's both diet and exercise. However, we do know that weight loss is hard to achieve and it's particularly difficult to sustain, particularly at the levels that are required for benefit. So my research really looks at the role of exercise independent of weight loss, so without any change to the scales, and importantly, what types and approaches to exercise are beneficial for reducing things like liver fat. Our clinical trials have had people living with obesity and MASLD come into our labs and undertake supervised aerobic exercise at a number of different doses. So our first research question really looked at whether volume, duration or intensity of exercise mattered more for reducing liver fat. What we did find was that aerobic exercise at any dose was beneficial for improving liver fat. So people could choose if they prefer to have a higher volume at a lower intensity or a higher intensity at a lower volume. We've found that ideally 150 minutes to 240 minutes of aerobic exercise at moderate to vigorous intensity per week is beneficial, but even doses as low as 135 minutes per week, so that's 3 sessions, 45 minutes at say a moderate intensity paced walk, is beneficial for improving liver health. What we're currently doing is leveraging the research findings that we've had in our clinical trials and translating them into clinical practice. So recently, I collaborated with Exercise and Sports Science Australia, or ESSA, who is the leading professional body for accredited exercise physiologists, exercise scientists and sports scientists in Australia. We also collaborated with a number of international and multidisciplinary experts in the fields of dietetics, hepatology and exercise physiology to create exercise guidelines for the management of MASLD. Our research work also contributed to other international guidelines, so I was invited to contribute to the American College of Sports Medicine Australia position statement on physical activity for MASLD, and our work collectively has been adopted and used in over 15 policies and guidelines from a large number of institutions worldwide. So this includes the large European and American liver associations, so ideally being used by clinicians and practitioners on the ground to help use exercise to manage their patients living with this condition. What we have found is that people with MASLD do really well in terms of adopting and adhering to exercise in our clinical trials. The challenge is sustaining and maintaining that behaviour long term. So one thing we're currently doing is working with people living with the condition to hear their needs, their opinions, their perspectives and experiences of exercise, to be able to design and deliver really tailored exercise solutions that will help people living with MASLD to sustain and maintain exercise long term.